My wife and I were married in July of 2008, and we had our first baby in August of 2009, and that was Grace. A month and a half later, I was asked to go into my doctor's office, and he told me that I had cancer. I can remember that as plain as day right now, and came back to the house and actually sat right here when I told my wife for the first time that I had been diagnosed with thyroid cancer. I had to receive radioactive iodine treatment, and that required me to be in isolation in the hospital for a period of 3 days. And so I was literally a radioactive individual. However, once I was able to go home, because my wife was still with a newborn, they actually had to move out of the house. So now I was in isolation in my own house for an additional 2 weeks. Wasn't exactly a fun time, certainly wasn't a memorable holiday for good reason. The one thing that I really look back at and smile at is my interaction with the nurses. Those smiles and those waves that they gave me over the course of those 3 days were so uplifting. They probably didn't even realize what impact they had on me. So today life is good. I have two little girls. Grace has grown from that 1.5-month-old girl when I was diagnosed to now being almost 5 years old and in junior kindergarten. And our second daughter Holly being almost 2 years old now. I really do enjoy being a dad. It's so much fun, and it's great to be able to see parts of yourself in your kids. Lakeridge has definitely been our family's hospital for a number of reasons. My wife and her 3 siblings were all born at that hospital, and now my 2 children have been born at that hospital. In addition to the fact that that's where my doctors are, and that's where my treatment for my cancer occurred. Cancer has really given me the opportunity to sort of reevaluate my life, reevaluate things that I've been able to cast aside because it's just not worth it. You know, I really try and do things that I know are going to be things that make me happy, that can be positive influences on myself and my family. It was an easy decision for us to become donors of Lakeridge Health. Supporting your local hospital, I think, is really important for all of us to consider, and it's really important for us to make sure that our local hospitals are strong, they're vibrant, and they have the resources that we need.